Welcome. I am Terry Tropin, and today I'll be discussing notes you should make in your ICD-10-CM code books. This is to make coding selection easier, faster, and more accurate. Let me start with telling you about myself. I have a master's degree in healthcare administration informatics from the University of Maryland Global Campus and have RHIA and CCSP certifications. I'm also an AHIMA-approved ICD-10 trainer. I taught health information technology at Montgomery College in Maryland for over 20 years. I've also written books on coding. Here are the books I wrote. These are available on Amazon. So I have Evaluation and Management Coding Made Easy, ICD-10-CM Coding Guidelines Made Easy, and ICD-10-PCS Coding Guidelines Made Easy. These books are available on Amazon and updated every year. This one and this one, the 2024 versions are already up. This one, the version for 2024, will be up late November, early December. So what are we going to talk about today? First, I'm going to talk about why should you make notes in your car, in your book. I know we were taught as kids, don't write in your books, but this is different. It's a textbook. You're going to make notes to make it easier for yourself. I would also say that you should write your own notes. Make your book work for you. If you find something confusing or you find something hard to remember, write it in your book. It'll make it so much easier in the long run. Particularly if you're a student, every time you have trouble finding a code, write that code, write a note in your book, in the Tabular List or the Alphabetic Index, whichever makes sense. So that next time you come across that same problem, that same question, you have a note and you don't have to go through all the trying to figure it out again. So I'm going to talk about some notes that I find helpful. You may have different notes. You may approach things differently than I do. Make your book work for you. So here's what I'm going to talk about. I'm going to give an example of why make notes. Then I'm going to talk about notes you can put in your alphabetic index, notes that you can put in your tabular list, notes for the Neoplasm table, and notes for the table of drugs and chemicals. So here's an example of why you should make notes. So you might have documentation of abnormal circadian rhythm. You know this is related to sleeping, problem sleeping, so you look up the main term sleep, circadian rhythm. It's not there. It's not under sleep, it's not under circadian, it's not under main term rhythm. It's not there. So you'll find it under the main term disorder, sleep, circadian rhythm, not where you would think of right away. So what are you going to do? Well, go to this entry. Let me make sure I got this pronounced right. It's kind of difficult. You've got chyluria and you've got cicatricial. So find that in the alphabetic index and write there where it would be if it was in the index. That's where it would be alphabetically. Write in circadian, G47.20. So that way, next time you're trying to find that, it's right there. So let's look at some other notes for the alphabetic index. First, find the main term alcoholism. Write in code as dependence. Okay? A lot of people get confused about this. So you go to dependence and then you can find alcohol. And this makes it clearer. Another one that's really helpful, I find, is COPD. Now, you're not going to find the abbreviation COPD in your alphabetic index. You can look up disease, pulmonary, chronic, obstructive. That takes too much time. If you're trying to take a test, you don't want to have to go through all that. So go to Cooper's disease and Cooper itch, and that's where it would be alphabetically in your book. So write COPD J44, and that will refer you automatically to where you need to be. Alphabetic Index for diabetes includes a lot of important subterms. This is a very long entry under main term diabetes, so you want to be able to break it down so that your eye will catch it easily. So highlight these subterms: due to drug or chemical, due to underlying condition, gestational, out of control, specified type NEC, type 1 and type 2. This way it'll draw your eye right to the subterm you need without going through a couple of pages worth of subterms. Okay, let's look at fractures. So highlight fracture pathological and fracture traumatic. Write in next to fracture pathological due to disease. Write in next to fracture traumatic due to outside event or injury or whatever. Just, I know you know that, but sometimes you're going through it really quick and you get confused. So be sure you want to be sure you get the right type of fracture. The same confusion may occur with the entries for history. Highlight the main terms for history, family, and history, personal. Then draw a line after the last entry for history, family, which is vision loss, visual loss, and the beginning of history, personal. So draw a line, and that makes it clear this is where family history begins and family history ends and personal history begins. Also in history, there's some other terminology that you might originally think was under history, but it might not be. So you can write in other terms such as status, absence. If you have a history of removal of the appendix, write absence, and you look up absence as the main term. Follow-up, aftercare, presence, abnormal, anomaly. There are other terms that can be confused with history, and this will refer you to where you need to go to find the correct code. Okay, if you're trying to find the code for sickle cell anemia, you might first look up anemia, which makes sense, subterm sickle cell, but it's not there. So there's a reference to see disease sickle cell. So sickle cell anemia is listed under disease sickle cell. But if you go to anemia, sickle cell, where it refers you to disease, write in D57 and you have it right there. This is another one of my favorite ones. The abbreviation SIRS, S-I-R-S, is not in the index. You look at the index, it's under Systemic Inflammatory Response Syndrome, not SIRS by itself. It's not under inflammation, inflammatory, it's not under syndrome, it's under Systemic Inflammatory Response Syndrome. So we want to make that easier. So turn in your alphabetic index to Sakari's disease, city. Write in SIRS R65.1. You might also write to syndrome, inferior vena cava, insipidate bile, and you can also write SIRS R65.1 in case you look up syndrome instead. So that's where it would be if it was there alphabetically. Okay. Okay, hypertension. There's also a bunch of subterms in the index. Find and highlight these subterms: cardiorenal disease, gestational, heart, kidney, pulmonary, secondary, and resistant. This will take you several pages of main term under hypertension, and this will take you to the correct code. Similarly, infarction has a number of subterms that you want to highlight. So under infarction, highlight myocardium, myocardial, non-ST elevation, subsequent, and post-procedural. Make it so much easier to find. Now, pregnancy in the index goes, as a main term, goes on and on and on and on and on. Now, it has two main sections: pregnancy complicated by and pregnancy supervision of. And it's easy to look under complicated by and say, hey, wait a minute, it's not there. But it is, it's under supervision of. So highlight complicated by, and then write in, or highlight underline whatever, diabetes, hypertension, multiple gestation. Go under supervision of, pregnancy supervision of, and highlight, underline, weeks of gestation, quadruplets, triplets, twins, and anything else that you need to find in there. Okay, so it's particularly weeks of gestation is an important one to have because that was also often overlooked. So let's look at ulcers. So find ulcer and then find pressure. Look up peptic, skin, stasis, and lower limb. Those are the main subterms. Now under peptic, this is often confused. Under peptic, write in peptic equals unspecified. Do not use if the site is known. So we only use peptic. We assume that peptic means gastric, but it doesn't necessarily. So you only use peptic if it's unspecified. Peptic unspecified ulcer. So that's important to remember also. So let's move on to the neoplasm table. One of the things that students often get confused with is, or what they forget to code for, unknown site. So there's the primary site and there's a secondary site, but documentation doesn't tell you where that other site is, or the other way around. You may have a secondary site and may not know where the primary site is. So circle the entry in the table, in the neoplasm table for unknown site or unspecified. And then on the page before the table starts, write in site or primary, secondary, not documented, see unknown, unspecified. It's very, very often missed, and so that's why it's important to write in a note. Okay, also on the neoplasm table, on the pages before the table, write the definitions if you need to. The most important ones to have in there are the difference between uncertain behavior and unspecified behavior. Those, again, are often confused, and so just write it in your book so you don't confuse them anymore. The other thing to write in that page before the table is histology. Remember the guideline for histology. If the histological term is used, you look that term up first in the alphabetic index, not the table. So this means that if the documentation states something like myeloma, leukemia, you look up that term in the alphabetic index, not starting at the neoplasm table. Now the term in the index may refer you back to the neoplasm table, or it may just list a code. So just make yourself a note saying, look up the histological term, not in the neoplasm table first. There are also some notes you can make for in the table of drugs and chemicals. Sometimes the documentation will just say chemotherapy and not say specifically what the drug is. Chemotherapy is not an entry in the table of drugs. So write it in between chemical substance, NEC, and chenodeoxycholic acid. So at the beginning of the table, so write chemotherapy drug there, and it refers you to antineoplastic NEC. Now this goes back to at the beginning of the table. There's a specific drug is unknown, see entry for purpose of drug. So under anti in the table is anti-diabetic, anti-infective, anti-neoplastic. And if you don't know what drug it is, but you know what it's being given for, what it's being administered for, look that up. Anti-diabetic, anti-infective, whatever that can be. So that will, a lot of people don't even know that that's there, the anti whatever entries are even there. Okay, so also for the table of drugs and chemicals, you have those columns at the top. Remember that poisoning is also used for toxic effects. Toxic effects is not used in there, but toxic effects, of course, are chemicals or drugs that are not used in treatment. So it's an effect of poison ivy. There's no medical need for poison ivy, but that's a toxic effect, and you use the column for poisoning. Okay, the external cause index is very confusing and repetitive. So try to break it down in the way that works best for you. I would definitely highlight the main terms: accident, accident transport, assault, legal intervention, suicide, and terrorism. Also look at operations of war, and there's a note under there that says it's war, insurrection, peacekeeping mission. Under military operations, highlight peacekeeping or military on military property, military exercises. So operations of war is war, but military operations are also military, but not war. It's like on military property, military exercises, that kind of thing. But that's easy also to confuse. So let's move on to the tabular list, the list of the actual codes. First, turn to B20. So in that entry, write in confirmed HIV/AIDS B20, no symptoms now or ever Z21, exposure contact Z20.6, prophylaxis Z29.81, testing Z11. So lots of possibilities for B12, and so you want to make that clear and easy to find. And again, we go back to COPD. So under the code categories for J43, J44, J45, write in next to the excludes one note, do not report also. Write in next to excludes two note, code also if documented. Now you know what excludes one and excludes two mean, but this reinforces that do not report, report also. So look at the J44, there's a note under that for code also type of asthma, circle that. Under J44.9, circle also code also infection. So just write those notes that are easy to miss that will be helpful to you in finding a code quickly. Okay, hernias. So look at section, there's a whole subsection, K40, K46. Write in there, obstruction equals irreducible, incarcerated, strangulated. All of these terms are used and coded as obstructions. Okay, look for the codes for diabetes. For E11 type 2 diabetes, circle note about the Z codes and also write in unspecified. If the documentation doesn't say type 1, type 2 or whatever, you use E11. So under code E13, there's also some specific guidelines for post-pancreatectomy. It is code first E89.1, then E13, then if it's appropriate, Z90.41 and Z79 codes. So this is very specific guidelines and you can just write that in so you have it right there. Okay, turn to chapter 5, the heading for mental disorders. Drug abuse, use, and dependence. Very specific guidelines. What it basically means is if dependence is mentioned, you code dependence. So you code the worst case scenario. Use and abuse, documented code for abuse. Abuse is worse than use, so you're going to use abuse. Abuse and dependence. Use abuse and dependence, or use and dependence, you code for dependence only. So you're going to code one code, and that's easy to just write in there, and then you have it. Okay, turn to G40, G44. Intractable. Write in intractable equals pharmacoresistant, treatment resistant, refractory, poorly controlled. A lot of the codes will use the term intractable, but the documentation may use poorly controlled or may do treatment resistant. So write in that if these other terms are used, use the codes for intractable. Okay, turn to codes A45.0, MRSA and MSSA. These are really confusing, I think. So go to A49.01 and this is MSSA. A49.02 is MRSA. So write that in so you can differentiate between those. It's very easy to pick the wrong ones. Okay, myocardial infarctions. So at I-22, circle the note that says within 4 weeks, 28 days of previous AMI. Under I-21.4, write in non-transmural / subendocardial. That's what those are coded there. This is all from the guidelines. I-21.A, other types of AMA, write in type 2 to 5, initial and subsequent. I-21, write in used for type 1 or unspecified. Now also look at I-21, it has a lot of location terms, anterior wall, inferior wall. Highlight those, underline those so that you can see that quickly. Okay, K27, write in peptic ulcer equals unspecified ulcer. Do not use a specific site as documented. Okay. We kind of talked about that before, but it's an important thing because this is really often missed. Hernia, K40 to K46, write in with obstruction, irreducible, incarcerated, strangulated. All of those mean the same thing. All of those are coded as obstruction. Okay, in the perinatal conditions, at the beginning of this chapter, 16, write in perinatal condition, patient older but still has condition, use code from this chapter. So if I have something, I'm in my 60s, say, and I have something that occurred when I was a newborn or in utero, you're still going to use a code for the perinatal condition, even though I'm not even close to perinatal anymore. So also in this chapter, find P35.A. Write in COVID-19 if contracted in utero or during birth process. Code also U07.1. Now the P35.8 code does not specify COVID-19, but the guidelines do, so write that in. So the most confusing part of poisoning, adverse effects, underdosing codes is which one comes first. So at the beginning of this section, write in poisoning, toxic effects, suicide, assault, list T code first. For underdosing, adverse effects, list first condition, then T code. So this right there you have, you can just go, okay, this one is first and this one is next. So this makes it easier to find your code. The pregnancy chapter also needs some notes. Circle first those definitions of trimesters. They may not, the physician may not document a specific trimester, but may give you weeks. And then you can pick the trimester from those definitions. Another thing tricky about pregnancy in the tabular list is that the tables. In most cases, the tables used for number of fetuses. These are seventh digits. In some categories, not some but not all codes in that category will require a seventh digit for the fetus. So mark those out. Make some kind of mark, whatever works for you, circle it or whatever, that these do not require a seventh digit. In category 033, no seventh digits for 033.8 or 033.9. In category 090, no seventh digit for 060.0. So that's important because it gets so confusing. Okay, for pressure ulcer, L89 pressure ulcer, circle first the note that says code first any associated gangrene. So if there's gangrene, you code that first. Also write in the definitions for unstageable and unspecified because those are confusing. Unstageable means the physician can't determine what stage it is. It may be covered, that could be. It may have a graft over it. Write in unstageable, stage cannot be clinically determined. Unspecified, write in not enough documentation to select a stage. So it's a stage, but they just didn't document, just didn't write it down. Okay, sepsis. Sepsis is very confusing. So turn to R65 in your book and write never listed first, only severe sepsis, and also some of the codes talk about non-infectious process. So let's define what that means. Trauma, burns, neoplasm, other injuries, okay? Organ dysfunction must be documented as due to sepsis for it to be severe sepsis. Also write in sepsis plus related organ dysfunction equals severe sepsis. So if there's a related organ dysfunction and sepsis, then it is considered to be severe sepsis. Okay, also in signs and symptoms, turn to R40.2, coma. Write in, use scale for traumatic brain injuries. If other causes, use R40.20. Also write after admission code only once in a 24-hour period. Okay, those are from the guidelines. So next to R40.20, write in, use if total score or individual score is not documented. So write in a line, draw a line between R40.236 and R40.24. Draw a line in your book and write in, use either all three of the above for the different measurements for the scale, or R40.24. One or the other, not both. A lot of students will want to do both, and that is incorrect. Okay, external cause codes. This is really stupid. They even still have these codes in, but they do. So next to code Y99.9, write in do not use. That's in the guidelines. Next to code Y92.9, write in do not use. Next to the heading for assault, the category X92 to Y09, write in CY07 perpetrator. Okay, you want to be sure and get that. That's also one of those things that's easily missed. Okay, Z codes. So let's look at Z codes for sterilization. This is also easily confused. Z30.2, write in tubular ligation vasectomy, this encounter. Next is Z98.51, Z98.52, write in tubal ligation vasectomy, previous encounter. So it was done before this, before the patient is being seen today. Also next to Z30.4, write in prescribed during previous visits. So the patient's coming back to make sure, are there any problems with your birth control pills, which were prescribed, a month ago, 2 months ago, whatever. So these are really confusing to a lot of people, so write that in. Okay, so also for Z codes, at the very beginning of this chapter, this is chapter 21, say see guidelines 16, Z codes that can only be listed first. Okay. Make sure you have a note to go back to those. So write in notes about the difference between aftercare, follow-up, and screening. Aftercare, patient still has condition. Follow-up, treatment completed. They're not being treated for the condition at all anymore, but they're just being followed up. Often in Neoplasm codes, they'll do a follow-up just to make sure it hasn't reoccurred. Z11, Z13, and Z36 are screening codes. Write in routine testing without symptoms. This is like your annual mammogram, your annual pelvic exam. There's no reason to believe there's a problem. It's just good medical care to screen you for that. Okay, so that's all the notes I have, but you may have others. Write in anything that will help you locate the code quickly in the Neoplasm table, and the table of drugs and chemicals, and the tabular list, alphabetic list, whatever you need. Anytime you have trouble locating a code and then you finally find it, add a code to the alphabetic index so next time you can find it easily. Anytime you have trouble with guidelines for a code, make a note in the code, highlight the guidelines in that chapter, whichever works for you. So here again are the books I have written on coding. They're available on Amazon. The PCS and CM books have been updated for 2024. This one, the update should be available late November, early December this year. So hopefully, unless there's a problem. So if you would like a copy of the slides, give me a thanks and send me your email address at terry.tropin@gmail.com, and I'll send you a PDF. Oh, and my books are updated every year or as needed. Thank you so much for listening. I hope this was helpful for you.